Psychology practice in Singapore will soon be regulated under a new framework, raising standards in higher risk areas and strengthening public confidence in mental health care. Nadine Yeam with this report.
Mental health is a key concern in Singapore. The latest National Population Health Survey shows that about 1 in 4 young adults have reported struggling with stress, anxiety and isolation. But there's also been a greater willingness to seek help. To support this growing demand, the Health Ministry is establishing a regulatory framework for psychologists, a move many in the field are looking forward to.
It is a timely and important milestone for the psychology profession in Singapore. So as families and more families seek psychological services across the hospitals, schools and community settings, having clearer regulation will ensure that services are delivered according to professional standards, norms and conduct.
For a start, 5 psychology subdisciplines will be regulated under this new framework. These are clinical neuro, counselling, educational and forensic psychology. These are areas where psychologists are known to provide more direct care to patients considered to be of higher risk, display more moderate to severe issues, or may need interventions that warrant regulatory oversight.
MOH and partner ministries will work with Singapore Psychological Society, SPS, to raise public awareness of the psychologist professions and support our professionals and stakeholders in navigating the registration process. The detailed registration schedule, requirements and roadmaps will be announced by early 2027.
MOH says the framework aims to raise the standard of care, given there will be greater consistency when dealing with a patient. But with many pre-existing standards locally and abroad, one psychologist says registration requirements have to be properly developed to ensure the framework remains fair to all.
We want to be inclusive so that certain programs, all this will take that into consideration, and how we can actually ensure that the whole psychology community will move along for the registration matters.
Ms. Xiao, who's also a member of an implementation committee looking into this, shared there'll also be provisions for practicing psychologists who might not fit the requirements.
The intent, is not to be disruptive to existing practitioners, but to ensure that over time, all registered psychologists meet the required standards.
And to ensure a steady stream of talent in the field, MOH is also working with the Education Ministry and National University of Singapore to offer eligible undergraduates the option of an accelerated pathway, specialising in clinical psychology at the master's level. The pathway, which would be completed in 5 years instead of the usual 7, is set to roll out for the intake cohort from this year.